Hello viewers, my name is Helen Ibe. In this short video presentation, I'll be talking about advanced directives, types of advanced directives, benefits of advanced directives, and the perception most people have about advanced directives. What is advanced directives all about? Advanced directives are legal documents that are completed in advance of the need for major medical decision to specify which healthcare options are desired or are not desired at present or in future when the person can no longer decide about his or her care. It is just pretty simple documents that is legal, and you don't have to go through great expenses by using attorney or getting it notarized. It's something that you can download online. The template from that you can download it online and write it down and make your decision about your care in future. We have different types of advanced directives, such as durable power of attorney, the living will, do not resuscitate orders, the physician or medical order for life-sustaining treatment. Most of the time, people tend to misunderstand which one is which. So, in these types of advanced directives, power of attorney, durable power of attorney, is when a patient or someone is designating somebody that can act on his or her behalf when that person is incapacitated or can no longer function. But living will is something that you have written by yourself, that this is what you want your care, how you want your care to be done in a situation you can no longer decide or can no longer talk for one reason, for one problem or the other. And do not resuscitate order is something that specifies those measures that will or will not be performed under the do not resuscitate order. This may include not administering chest compressions, resuscitating drugs, defibrillations, artificial airways, and the cardiac monitoring. According to Mark Werner, in his article on an advanced directive, he stated that most Americans are unprepared for the worst to happen, something like an accident or an unexpected illness, that leaves the person brain dead but still alive. Of course, we don't like to think of death and dying, but it happens whether we like it or not. I conducted a random interview a few days ago, asking people what they think about advanced directive and whether they have advanced directives. A lot of people say that they don't have. There's nobody among the people I interviewed, nobody told me that he or she has. When you ask them why, somebody say, yeah, I don't know. One person said, I don't think it is necessary that when a death comes, I can die. I ask the person, what if in a situation that you are in the hospital, you cannot talk, and the doctors, they don't even know what to say. The person says, oh, whatever my children says are best for me. I don't have to tell them. Because people think that when they have advanced directives, that death is imminent. But that is not it. It is something that help health caregivers to decide, to know exactly the actual thing that needs to be done for a patient in a situation that maybe the treatment that patient is getting is like futile treatment. So, but when the patient has an advanced directive, this will enable the physicians to know the actual things that will be done, either to continue treatment by sustaining that person with life support or to end every treatment and let the person die peacefully. People don't want even to hear about this, about death, but then it must come whether we like it or not. Honoring patient preference has resulted in fewer tests and less expensive procedures that are not even useful. When the dying has an advance directive about the type of medical treatment he or she wants, in a situation when that person can no longer function, and the loved ones take a decision based on the person's will by stopping any life support measures according to the patient's will, and the patient later dies, the loved ones will not be nursing any guilt or any guilt of their loved one's death, or maybe they contributed in the loved one's death. No, rather, they will be comforted because they respected the person's will. As the case of Melis Monoz, as written by Caleb and others in the publication Brain Dead Texas Woman Taking Off Ventilator. Melis Monoz did not leave a written advance directive regarding end of life care, but rather she instructed her husband and the family members that she wouldn't want a machine to keep her blood pumping or any life-sustaining measure, but it was not documented. So saying it is a different thing, but writing it down makes it more valid. And when we talk about the physician's order for life-sustaining treatment, that one, the patient will sign it and the physician will sign it. That one can be carried to any place whenever the patient is in the hospital. It's not the document that can be they are looking for, because most of the time the advance directive are not even found in an emergency situation. So honoring patients' preference is better. It will help decision making in a situation. And without advance directive, families and providers may erroneously assume inaccurate end-of-life wishes and decisions. So it is advisable that this very document that people will come to realize and see the importance of this document and think about it and think of having it in a situation that the person cannot decide for him or herself. Thank you all for listening.